Hi everyone. This short video is just to help with completion of the formative and summative assessments that are required during our clinical placement. There are 2 formative assessments due throughout the year. In general, we say after about 100 hours of placement. However, there are check-in dates in the clinical course study desks, so students should have a really good idea of when their formative assessments are due throughout the year. This cover sheet indicates that students need to just fill out or just circle which clinical courses they are enrolled in for the year. Full-time students will be enrolled in 2 of these. Part-time students will be enrolled in 1. But we just need to have this circled so that we know what clinical courses this particular assessment relates to. Students need to complete a bit of a self-assessment first. So just describing the skills that they've learned in residential school, anything that you're studying in theory courses, just what is relevant to this particular placement, and identify some learning goals. So whatever your learning goals are for this particular placement or this particular assessment period, just write these down. At each assessment point, it's important just to identify whether you've reached these goals or not. It doesn't matter if you haven't, you just roll them over. It just helps to keep you focused on what kind of learning outcomes that you would like. Our formative and summative assessments are all pretty identical. Formative A is obviously the first one due. All of these are based on the midwifery standards for practice from 2018, all of the criteria here. And the assessment is based on the Bondy Scale, which is discussed in further depth in another video. The student needs to complete this formative assessment before they approach the educator. So student needs to go through and complete each one of these boxes based on the Bondy Scale and try to think of some examples that might be able to support their position and why they feel that they have assessed themselves this way with each criteria. And then after sitting down with the assessor and having a conversation, the assessor, who can be a clinical facilitator, an educator, a senior midwife with whom they've worked with quite frequently, can go through and have this conversation with them and complete their section of the assessment based on the Bondy Scale as well. So there's 3 pages to each assessment. This is page 2, which is the final standards there. And then an overall grading. And we just want an overall grading of where the student is at this particular time. We expect first year students to be, supported or assisted. We don't expect miracles to happen, but towards the end of placement, we would hope that a student is starting to become more proficient and independent in their practice. And then student names and signatures and dates down there as well. The final page is just an area for comments, and it's really important that we do get comments from the facilitator or educator, because this is what helps to grow our midwives and helps them to identify what they're doing really well and identify where they can make some improvements or perhaps focus on a little bit more. And we also ask that students make their own comments and their own kind of mini reflection about how they feel this placement has gone and whether they feel as though they are meeting their learning goals, if they are flailing in some way, if everything's just going wonderfully. We love to hear all the good, the bad, and the ugly. This is how we help to support students and to help them to grow. Formative B, exactly the same process as formative A, and the summative assessment, which is to be done at the end of the year placement And again, exactly the same process. Again, if there's any problems or any concerns about completing any of these, either from students or from facilities, do not hesitate to reach out to any of the USQ team. Thanks, everyone.